Welcome to the San Juan Basin Public Health 2021 Open Enrollment webinar. This is the first webinar we've ever held, so thank you for virtually attending. My name is Emma Tomlinson. I'm the health coverage guide at San Juan Basin Public Health, and Kevin O'Connor is also here, and he is the health literacy program lead.
Hi, everybody.
Thanks. Since we value your privacy, all attendees will be muted and you will not be able to show your video for the duration of the webinar. Your name will also not appear. If you have any questions, please move your mouse to the bottom of the screen and click the Q&A icon and any type of questions that you have. Kevin will be here as well to answer any questions. In this webinar, we will be introducing ourselves, giving a quick reminder of insurance terms, reminding you of the income limits to receive the tax credits, eligibility requirements, and what's new in 2021. Again, my name is Emma Tomlinson. I'm the health coverage guide at San Juan Basin Public Health. Kevin is the health literacy program lead. And we are both considered as sisters for Connect for Health Colorado, where we provide free, impartial information and enrollment services. Just wanted to give you a quick reminder of some insurance terms, including the monthly premium. This is what you pay for your health coverage monthly. The deductible is the specified amount of money that the insured must pay before the insurance company will pay a claim, but that's dependent upon your policy. Some services may be covered before the deductible is met. So for example, any preventative health care is for free, and that also includes flu vaccines, things like that. Your copay is a fixed amount for a covered service or a specific service that's paid by you to the provider before receiving the service. So you would pay the copay at the time of your appointment. The out-of-pocket maximum is the most that you'll pay for covered services in a plan year. So after you spend this amount on deductibles, co-payments, and co-insurance, your health plan will pay 100% after that. Co-insurance is the amount that's usually in a percentage amount that a person has to pay against the claim after the deductible is satisfied. So you'll be paying co-insurance after your deductible has been met. Kevin, anything to add for that?
Yeah, let me elaborate on a couple of things real briefly. The kinds of items that are covered without needing to meet the deductible first are often the things that you use most frequently, such as a routine office visit to your primary care provider. On most plans, an urgent care center visit would also be covered. And so you can get the care that you need without having to pay a lot of money up front most of the time.
Great. Thanks, Kevin. So people often assume that they aren't eligible for assistance due to their income, but this is absolutely not true. Health insurance can be affordable, especially when you receive assistance with tax credits. These tax credits help lower your monthly premium for health insurance. And as you can see on the screen, for a household size of 1, you can make up to $51,040 gross annually and still be eligible for tax credits. As a household size of 2, obviously here are the numbers right here, $68,960. You may be also eligible for cost sharing reductions, which are also known as CSRs, which help with additional costs such as copays and co-insurance, things like that. Kevin, any additions?
Just that, as Emma said, people are much more frequently eligible than they would expect or realize. Statewide, approximately 70% of everybody who requests assistance qualifies for at least some assistance.
Thank you. So let's talk about some eligibility requirements. Of course, you must be a resident of Colorado. You have to be a citizen or legally present. You must file taxes for the years that you're enrolled with Connect for Health Colorado. That being said, if you are married, you must file jointly, and you cannot be eligible for Medicare or Medicaid. Any additions?
Just that these are the requirements to use Connect for Health Colorado as your source of health insurance. There are some additional requirements that we just mentioned as far as income for being able to get assistance to help pay for your health insurance.
Great. Let's talk about what's new in 2021. First, there are new health plan providers. There's two. First is Bright Health. Unfortunately, Bright Health is not available to those residing in Archuleta County, but is available in La Plata County. They are offering lower premium prices than ever offered before, which also includes some zero deductible plans. Rocky Mountain Health Plans is also available in both counties, but with more of a higher premium cost. Same as last year, Friday Health Plans and Anthem Blue Cross Blue Shield are still available on Connect for Health Colorado. Connect for Health Colorado had a recent website change. So it was requiring everyone to change their password on Connect for Health Colorado. If you have not changed your password, you need to do so by calling the customer service line at 855-752-6749. Again, that's 855-752-6749. Another thing is, again, with those Bright Health plans, there are lower insurance rates, which is wonderful for our area. And that is because of our Southwest Health Alliance team, which brought Bright Health plans down to our area and really fought for cheaper rates for our community. Short-term policies are not available whatsoever. Brokers are allowed, but are not required to charge fees. This is not very common in our area for a broker to charge fees. And actually, a broker might be beneficial for some, dependent upon what's going on in your life. You know, if you have some more complex medical needs, where a broker might be a better choice for you to choose your plan. Kevin, anything to add?
Just that the fact that the Bright Health plans that are available this year have significantly lower prices than we've seen in the past is going to affect the amount of financial assistance that people are eligible for, because simply they don't need as much to be able to afford a good plan. So if you get a letter from Connect for Health that indicates that your cost is going up, you definitely want to shop, because there are going to be good options available to you at or below the rate that you paid last year.
Right. Yeah, I agree. Now's the time to ask any questions. Of course, if you have any questions that you may think of later, or you kind of want to talk to us about now, here's our contact information. So there's mine, Emma Tomlinson, Health Coverage Guide, provided my phone number and my email. Kevin O'Connor, who will eventually be leaving us December 15th, but he will be available until then. The Connect for Health Colorado website, which I want to make sure that you guys go to the correct website. Unfortunately, at this time, there are some bogus websites that are not the true Connect for Health Colorado website. So make sure you have the correct one before you go in and apply or put any information in. Also, the number for the Connect for Health customer service is on there. Just a reminder, if you haven't changed your password, that's something you need to do right away.
So the last thing that I'd like to say is that it's not complicated to give you a sense of what your insurance options are. With a 5-minute phone call, we can take your income, the ages of the people that are in your family, and give you a sense of what your choices, the range of choices might be. So please feel free to give us a call, shoot us an email, whichever is more convenient for you, and we'll be able to do that. And then you'll know what your options are and make a good decision based on that.
Thank you for attending. And again, if you have any questions, give us a call or shoot us an email. You can also go online to sanjuanbasinpublichealth.com and find out information from there as well.
One correction, that's San Juan Basin, SJBPublichealth.org.
Oh, that's right. I apologize.
Thanks for being here.